Diabetes is a condition where you have high levels of sugar in your blood. Ideally, your body requires around the equivalent of 1 teaspoon of glucose or sugar in the blood at one time. To keep it there requires a fine balance, constant tuning, a balance that's mostly achieved by one organ, and that is the pancreas. The blood is constantly monitored, and if the blood sugar drops too low, as it would maybe overnight, then it would release a hormone called glucagon, which helps the cells release the glucose into the blood to get the level back up. And if it's too high, for example, just after you've eaten a meal, then the pancreas would release a hormone called insulin to bring it down. And insulin works to encourage these glucose molecules safely into a cell for either storage or to be used, but most importantly, out of the bloodstream. And there are two main types of diabetes, type 1 and type 2. Most people fall into either or, but there are people that fall in between. Although each type of diabetes has the same end result, which is a high glucose, why the glucose is high differs between the two conditions. With type 1, the pancreas is not working at all. It isn't producing insulin, and without insulin, the sugar in the blood cannot be used as fuel, and it just circulates around in the blood. The result here is a rapid weight loss. The food you're eating won't get into the cells, so you can become very unwell very quickly. This condition can present itself very quickly as well. People with type 1 diabetes need to inject insulin to stay alive in order for their bodies to get that sugar from what they're eating. But type 1 diabetes usually starts in kids and adolescents. And why does it happen? Well, we often don't know the trigger, but we do know that the immune system has decided to attack itself and attack specifically the cells in the pancreas. With type 2 diabetes, you also end up with high levels of sugar in the blood. But it's a problem of too much insulin. In this case, the pancreas is working super hard and has in fact been working extra hard for many, many years. And it's because it's trying to keep up with the level of blood sugar and trying to keep it at safe range. It's working hard because there's too much sugar going into the blood in the first place, usually because of what we're eating, but there are many other factors as well. So with type 1 diabetes, you have high blood sugars and no insulin, but type 2, you have high blood sugars and high insulin at the same time. And you know what? That little hormone, insulin, is not designed to be in high quantities in our blood. It wreaks havoc with our metabolism. Type 2 diabetes is shortly going to be one of the most serious preventable health conditions in the UK. We're expecting 1 in 10 people to have the condition by 2034. And that means many of us are already on the way. And what many people might not realise is that changes can be starting to happen decades before you get the symptoms. Although the glucose or the blood sugar may be normal for quite a while, the insulin level can be creeping up for many years. With childhood obesity rates that as high as they are, teenagers and young adults are already pushing their pancreases really hard. And as the years go by, insulin makes you put on weight, and you enter a vicious cycle of high insulin and a state called insulin resistance, which makes the problem even worse. Although insulin is a great little hormone at pushing that glucose into the cell and out of the blood, it's also responsible for pushing the blood glucose into the fat cells, making us put on weight. So our body, by trying to be efficient in keeping that blood sugar level safe, is creating a problem for us down the line. As we know, your weight is so closely linked to diabetes. And the really important thing to realise is this. At the point of diagnosis of type 2 diabetes, half of the cells of the pancreas do not seem to be working properly. Half of the cells that are releasing insulin are no longer effective. The pancreas has reached burnout. The difference, what we're learning about type 2 diabetes remission at the minute, is these cells can work again unlike type 1 diabetes, unfortunately. Medication works in a lot of different ways to decrease the blood sugar, either by opening up the cells to accept more insulin, making the kidneys work harder to pee the sugar out, making our liver work harder, or even pushing the pancreas to work harder again. The problem is it's common to need more and more medication until you get to the point where the pancreas is not functioning very well anymore, and then that's when a type 2 diabetic starts using insulin. I commonly see people on 4 tablets for diabetes and then injecting on top. So tablets can lower the amount of sugar in your blood, but it does nothing to cure the actual illness or prevent the damage of having high blood sugars in the first place. And it's the complications that cause the harm with diabetes. This is where we get the real benefits from a lifestyle change, because it helps the pancreas work better. I'm a massive fan of the low carb lifestyle, and that's because the exact foods that's pushing that pancreas to work hard is glucose, sugar, and carbohydrates such as bread, pasta, rice, potatoes. Those are the biggest contributors. And it makes sense, doesn't it? If we can eat less or even cut them out, then the pancreas has a break. It has a chance to recover and has a chance to work better. Just as you would hopefully look after somebody that's burning out in your place of work. If you have a colleague that's struggling, can't take on more work, struggling with what they have, the worst thing you can do is keep piling on the work. You need to give them a break in the same way you would need to give the pancreas a break. And that's what we do. That's what we see huge benefits to the pancreas from doing, because there is this capability and this potential to improve those cells of the pancreas with type 2 diabetes. And that is a game changer.